Welcome. My name is Peter Strong, and I'm a professional mindfulness-based therapist living in Boulder, Colorado, and I provide online mindfulness-based therapy for anxiety and depression that does not use drugs as part of its treatment. So I do not regard medications as the first choice for treating anxiety or depression. Basically, drugs may minimize symptoms for a while, but drugs will not change the underlying psychological process that's causing your anxiety or depression. So that is what must be addressed very carefully if you are to achieve complete recovery from chronic anxiety or chronic depression. So in mindfulness-based therapy, we work on changing these underlying habits, these psychological processes that operate unconsciously to produce emotional suffering, whether that's anxiety or depression or any other form of emotional psychological distress. So these are a product of a conditioned, habitual, reactive process. And the problem is that we are not readily aware of this underlying set of habits that creates your anxiety or depression. So in mindfulness therapy, we focus awareness on our emotions. We actually learn how to apply mindfulness meditation to explore our emotions and to look at their structure to uncover these habitual reactive processes that are going on. Now, of course, one of the major components in that reactive habitual structure will be thoughts, will be reactive habitual thoughts. It might be chronic worrying, it might be catastrophizing, it might be rumination, but these patterns of thoughts are what actually feed the anxiety or depression. Now, it's important to understand that thoughts themselves do not cause anxiety or depression. That's a common misconception. It's actually the other way around. Anxiety tends to produce anxiety-based thoughts and anxiety-based thinking. And the same for depression. The emotional state of depression is what produces or takes form in reactive thoughts, rumination and depression-related thoughts. So they're the product of the emotion. They give the emotion a structure, and when they operate in a habitual manner, they simply feed and sustain that underlying structure of the emotion. So the first part of mindfulness therapy is really looking to see what these thoughts are, to identify them clearly. We then look at ways of changing our relationship to the thoughts. You can't simply remove the thoughts. That's another misconception. It's not as simple as that. What you can do, though, is change your relationship to those thoughts so that you do not just blindly identify with those thoughts. That's essential, and that's what typically happens when we are under the influence of habitual thinking. The thought gets triggered, and then we become the thought. We literally become consumed by the thought and the reactive thinking that will manifest when we become identified with those negative thoughts. So the first thing is to be able to develop conscious, mindful awareness of those thoughts, to see them very clearly when they get triggered in the mind, and then learn how to stay independent from them, not identifying with them. We do this through mindfulness meditation, which means that you learn how to meditate on those emotions and on the habitual thoughts that feed the emotion. We train with them, essentially. We train in not identifying with those thoughts. It's like learning to develop balance on the edge of a river so that you don't fall into the river and get swept away. Well, thoughts are very much like a river. They have a lot of energy in them, and if we're not careful, we fall into this river of thoughts, and that basically takes us away and creates a lot of emotional suffering, and simply feeds and reinforces the emotions underneath. So learning to develop independence and learning to develop balance in relationship to thoughts is a very necessary step to successfully overcoming anxiety or depression. Another thing that we must look at is the emotion itself beneath the thoughts, and we must build a different relationship with that emotion as well. With the same principles in mind, we must learn to observe the emotion and not become identified with the emotion. We must learn to see the emotion as a mental object that we can be conscious of, but not become identified with and not become reactive. So holding emotions in conscious awareness is an essential part of mindfulness meditation. We deliberately find our anxiety or depression and we meditate on it, learning how to create this space around it where we maintain independence and balance. Then we can investigate another aspect of the emotion, the structure of the emotion, and that is its imagery. So all emotions are basically structured around psychological imagery, the way that you see it in the mind. And we must find out about this imagery and look at its structure in great detail, because when you change that imagery, you basically change the emotion. The two are directly related to each other. So emotions are structured in imagery, and that imagery is what actually causes the emotion. So thoughts do not cause anxiety or depression. What they do is they trigger this emotional imagery, and that is what causes the anxiety or depression. So seeing this imagery is very important because it is also basically habitual in nature. We do not normally see that emotional imagery. It is operating at an unconscious level. So we bring lots of conscious awareness to our emotions in our meditation in order to explore this imagery. And then when you can get a clearer insight into the imagery, you can begin to change it. For example, the imagery of depression typically will have the color of black, or will have some other dark color. It's very unlikely to be associated with a bright, color like white or pink, for example. So that color is part of what causes the depression. That's part of its imagery. When you identify its color, you can actually start to explore changing that color, because it's just habit. Always remember that. It shows up as a black image out of habit. That does not mean that it has to stay that way. When you bring conscious awareness to it, mindfulness, you can begin to change that habitual imagery. So you can change its color. And you explore during meditation what color feels best and what color allows that depression to decrease in intensity, and what color would help it heal. Our goal in all meditation work is one of bringing about and facilitating healing. So changing the imagery is how emotions heal. And very often they will do this by themselves. Over time, they will change their imagery, and that's how they heal. But it can take a long time if there's a lot of reactivity around the emotion that's feeding it. So in meditation work, we can speed up the process of change. We can explore changing its color. We can explore changing its size. We can explore changing its position. How close is it in our awareness? Is it in our head? Is it in the stomach? In our throat? In our chest? Where does it habitually reside? That's part of its imagery. Again, when you find out where the emotion resides, you can change that habitual position. And when you change that position, you will change the emotion. And you can help the emotion heal by changing its position. There are many, many other factors like that we actively explore during mindfulness meditation. The whole purpose of mindfulness meditation is to explore the mind, the actual processes that are involved in creating either suffering or well-being and happiness. We look and find out. That is the nature of the process of mindfulness meditation. And also in that process of exploring our mind, we also cultivate this very different part of our being, which I call the true self, which is simply the one that is observing the emotions and the thoughts and the memories and other content. The observer is not the same as the observed. If you're looking at anxiety or depression, that means you are not anxiety or depression. So this quality of developing the observer that witnesses and explores and interacts with your emotions is very important. This leads to liberation from those habits of emotional suffering. In a sense, you could say quite correctly that the observer, the true self, cannot suffer. The suffering is contained in the contents of mind, the objects of mind, thoughts, emotions, and memories and other reactive conditioned processes. That is what causes suffering. And so by developing that part of you that's the observer, you essentially are freeing yourself from those habitual processes. And in that liberated position, you're able to respond to those habitual processes in a way that helps them heal. So that's another way of looking at what we mean by mindfulness meditation. It's developing this very different sense of being that's not identified with the content of mind. And your true self is not the content of your mind. You are not your thoughts. You are not your emotions. You are not any of these mental objects that you can perceive. That's simply content. It comes and goes. It changes all the time. But the one that observes that content does not change. So consciousness is constant, whereas the objects of consciousness change. So if you'd like to learn more about mindfulness-based therapy and how to overcome anxiety and depression without using drugs, and you'd like to really examine the actual process that's causing your emotional suffering, then please do go to my website and learn more about online mindfulness therapy. Please contact me if you have any questions. Please tell me more about how I can help you. And when you feel ready, we can schedule some Skype therapy sessions to help you learn how to apply mindfulness and mindfulness meditation for overcoming your anxiety or depression. So please contact me and let's schedule a Skype therapy session. Thank you.